Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm joined with the co-founder and CEO of TailorMed, Srulik Dvorsky. How are you today?
I'm great. Thanks, Jared, for having me. Great to speak with you.
I'm excited to chat. I think we should dive right into it. We like to keep these things nice and quick for the audience that's listening. I'd love if you could tell I'd love to tell if you could tell us a little bit about your background, and then we'll go into TailorMed.
Sure. So happy to tell you a little bit about myself. So co-founded this company together with Adam, our CTO, my co-founder, about 4.5 years ago. I actually came from a medical device background, spent about 10 years in that field, mostly in one very exciting company called BrainsGate, where we developed a new modality for treatment of ischemic stroke. But kind of along that journey in my professional life, I went through a challenging journey in my personal life. And I was the caregiver of family members who were diagnosed with cancer. And it eventually became to be something really meaningful in my life. And I think that started to create kind of an itch to maybe do something with my day job in technology and hopefully find ways to leverage that to help more patients. And this is kind of the backstory of how TailorMed started to come into fruition. So that's basically it. I am from Israel, and this is where the company has been founded, currently working with our teams in New York and in Tel Aviv, but on the line back and forth all the time.
And are you in Tel Aviv?
Yeah, at the moment, speaking from Tel Aviv.
Very
Sunny
cool.
Tel Aviv.
How are you? It must be interesting for you having to deal with the time difference too, because obviously you have the team over here. So, and is it this? I've done some work with people over in Israel. Is Sunday through Thursday the common work week?
It is, but it's not the case when you're running a startup that sells into the US ecosystem. So there is a very vague definition of work days and working hours, because you basically, a lot of our team members here, work their day, here in Israel, where our R&D office is. But all of our partners and team are in the States. So a lot of times the day restarts again at 8 p.m.-ish and extends through the night. It's definitely challenging for me and challenging for others. But I think the goal of really making an impact from here is the one that drives us to do that. We're trying to figure out the right way to balance those hours, but not always an easy task.
Yeah, it's not impossible. I'm sure it can be. It could be interesting sometimes, but that's yeah. Thank you for sharing. I'd love if we could go into a little bit more detail into the basically three things I like to focus on, and I got this from Simon Sinek, always talking about what customers care about the most, right? Your why, how, what. Could you talk us through that, and then we can go into some of the other things about TailorMed?
Absolutely, and I think that his talk and approach to this is also something that really helped me frame what I want to do in my life. So it definitely resonates. So I think the why is pretty straightforward. I think that when we are looking at challenges that patients are having throughout their care path, medical journeys, there are numerous, but there is one that has been really on the increase or on the rise in the last few years, which is the financial one. So patients are really struggling to afford their care to the point that that's the first and foremost frequent reason for patients to go bankrupt, or people in the States to go bankrupt. And it's not only that, some of those won't be able to get the medication they need, life-saving medication in a lot of cases. And that's something that is crippling for so many patients and families. And that's the why behind it. And I think that's what drove me to start this venture as someone who was a caregiver for family members with severe conditions. But I found that we're not alone, and it is something that affects millions of patients a year.
Thank you for sharing. I'm always really interested to hear that, and it's something that I don't think, even though it is so important, I don't hear enough companies like publicly put that out there. I think some expect, right, that. So I always want to ask that, because this is supposed to be the thing that's tagged to your company, right? That people can also look to this podcast to learn just quick snippets about what you're about and what you're building.
100%. And that's something that, everyone on our team starts the day with that notion in mind. It really speaks a lot. And to your question about how, I think it's also super important to think, there is a problem out there. What's the approach that you are taking to really move the needle in this space? And this is like the how stated for us. What we think should be done is, how do you identify patients in financial need as early as possible in their medical journey, and not when a patient needs to make that very hard decision whether I'm getting the care I need or not. And also from our provider and pharmacy partners, how do we detect those challenges as early as possible and address those? And I think the how is proactive. And I think that what we're doing is that there is a lot of technology behind being able to be proactive and discover those patients in need very early on, even before they get treated. And it's basically built on getting data from a variety of different IT resources, whether they're EHR, pharmacy management system, payers, claims data, and then putting all of that holistic patient profile into something that our algorithms can then go and predict what will be the financial risk or financial responsibility or vulnerability the patient is expected to have throughout their episode of care, and then come and address those head on proactively. And that's the how, because there are a lot of different tactics that could be done in order to try and mitigate it. But sometimes they are really far down the line when the patients are, super distressed and maybe even decided to abandon their treatment. And the what, just to kind of cover that point as well, I think is, there are an abundance of different financial resources that patients can enroll into and get funding to offset their out-of-pocket expenses. So if you are on a high-cost specialty drug, for example, there are funding available from manufacturers like pharma companies or foundation grants, or even like a county-based charity program down to Social Security that can give you premium assistance. And what we're doing is that after we have discovered those patients proactively, we're then facilitating automatic eligibility to a variety of different programs, more than 5,000 at the moment, and then helping them enroll to those programs. And if we are successful in doing that, that comes back to the why. We are able to get them the care they need without, incurring a financial burden, but also help our partners who are pharmacies and providers and different hospitals to provide this care and be able for them to maintain a good financial performance. So that's basically the full circle here.
How would you identify, and I'm sure there's a couple, but your ideal patient profile, your ideal patient type that you think that TailorMed helps the most?
So I think that it is essentially every person that has middle income to low income level and has insurance, but for the most part they would be considered to be underinsured, meaning they would have a high deductible plan, or there'll be a Medicare beneficiary that has a very high cost of prescription medication. Those people will be the ones that will find it the hardest to pay for their care. Those will be the ones treated by health systems or clinics or pharmacies throughout the country. And when faced with a bill that is a few $100s, but in a lot of cases thousands of dollars, will simply won't be able to pay that. And that's kind of, I wouldn't say our ideal patient, but that's the patients that we're seeing the highest need from, and also are able to serve this, because there are a lot of programs that will fit that criteria of patients with 400% of the federal poverty level and below, where a lot of those programs can really help.
I want to quickly shift focus to something that's still fairly recent, right? Your latest funding round. Can you talk us through a little bit about obviously continuing to grow? That's why you raised additional capital. But can you talk us through where you're going to really focus on, I guess, for use of proceeds? I'd be really interested in that. And then also, I guess, the excitement around the team for closing that up. That's a huge accomplishment. What was the internal talk about that, and how excited was everyone?
Happy to. And honestly, that's something that was just announced an hour ago. We actually extended that round and we announced it formally today. So let me speak about that in a second as well. So I think that this funding round in addition to just giving us the capital to allow us to grow the team, grow our pharmacy and provider networks, and continue to innovate in order to build better solutions that will serve any patient in any location that they get care, is really special, this funding round, because in addition to our investors that have backed us from day one that continue to participate, we really were able to bring a few strategic groups that I think will very much impact our trajectory moving forward. So the round was led by Providence Ventures, obviously one of the most innovative and larger healthcare organizations in the States. And together we were able to build a syndicate that brought on two other health systems, Unity Point and OSF, where I think, all of that together really speaks to how big the problem is, not only for patients, but also for healthcare providers, and how the leading health systems in the country look at TailorMed as being like the leading solutions for that. We were also able, and that was announced today, to bring on Citibank and their impact investment fund that really kind of speaks to how we play right in the intersection of healthcare on the one hand and finance, and how can we think about forward-thinking solutions to help patients in a variety of different financial resources. And last but not least, which is kind of closing the circuit for me personally, the American Cancer Society and their venture team called Bright Edge, also participating in this extension of the round. And that's, I think, very meaningful, because this is one of the biggest and most important advocacy groups in the country for cancer patients, really speaking about how big the problem for financial toxicity is, and how can we work together to educate on that problem and bring innovative solutions for that. And for me, as someone who was the caregiver of cancer patients, that really is something that is exciting me personally. The team is obviously very happy about that. Having the support of those amazing groups, and also having the capabilities from a financing perspective to continue to build and innovate is what gets us in the morning. So that is super, super exciting.
Yeah, congrats. Those are some not just great names, right? Those are some of the, for the audience, right, that maybe doesn't always follow those investors. Those are some of the most impactful investors too, that are actually going to help, not just give you a check, and obviously know healthcare very, very well. I mean, Providence is a legend in the space, and it's funny. What's the other one you were saying? Unity Point.
Yeah.
I know at Unity Point, Austin Duke over there. I don't know if you dealt with him at all.
Yeah, Austin and I basically met for the first time around a year ago, and eventually a few months ago, he was the one leading the venture team there to join this round. So he's a great guy.
Yeah, big fan of Austin. Super innovative. Doesn't take him. It takes him not very long to understand exactly where you want to go with the company, and it's been a pleasure having conversations with him. I need to get him on here to do a healthcare VC segment at some point, but that's awesome. So, well, congrats on closing the round and also extending it. That's even more exciting. I mean, getting the American Cancer Society and Citibank, because you're kind of on the line between this digital health tech, and also fintech, like you were saying, which is pretty unique, because there's not many companies that can kind of be at the intersection of both. So kudos to you for all of that getting put together and being finalized. I have a couple things I'd like to quickly dive into before we end up wrapping up here, if that's okay. So one of the things I wanted to talk through is, a big focus for you is removing financial barriers to care. Can you talk a little bit about why this is such a big issue? And then also, you already mentioned a little bit about how TailorMed's helping, but maybe just add the quick TailorMed 2 cents on top of that.
Absolutely. So I think that what we've been seeing in the last few years, but in general in the healthcare ecosystem, is that there is a growing dependency on patients being able to afford their care. And the recent dynamics in, payer-member relationships or cost-sharing dynamics between those are leaning more towards patients than in the past. And that really creates a challenge for both patients, obviously, and their families to adhere to required treatment. It's also imposing a lot of challenges for healthcare providers and pharmacies to be able to provide care for patients that won't necessarily be able to afford it. And I think that removing those barriers is something that a lot of different stakeholders in the ecosystem are trying to do, whether it's through how do you think about pricing different types of innovative treatment that are coming to market? How do you think about educating and transparency of cost in healthcare? And I think that everything eventually needs to come together from making healthcare more affordable. But when there are challenges, how do you identify them very early, make that discussion more consumer facing, which is bringing in transparency, but also finding the right ways to offset some of those burdens to other entities that can take some of the burden away from patients. But the second reason that I think that we are seeing a lot of debate and discussion around barriers to care is that, think about it, there are so many advancements in healthcare in the last few years, and these are new drugs coming to market, new devices, immunotherapy, or just recently mRNA technology being introduced for the first time. But usually when those come to market, it comes with a very high price at the beginning before those become generic or publicly available for everyone. And at that point in time, there is a tension between patients needing that life-saving or life-prolonging treatment to their ability to afford it. And this is why I think that barrier, that access to care challenge, is why you are hearing a lot about that, and why we are spending most of our time dealing with that. And I think that our secret sauce is again going back to how are you taking a very data-driven and predictive approach to finding patients in need, and how are we streamlining a lot of manual and cumbersome and decentralized tasks that are happening in that value chain from the manufacturer of those treatments downstream to the patients, and automating that with technology. That's basically what TailorMed does.
Thank you so much for sharing. That was something I wanted to make sure I asked you as we recorded this today. So really appreciate, once again, you coming on the podcast. I hope we can have you on again real soon to dive into some other issues that you're working towards. But it means a lot that you came on. I'm excited for your continued success, and congrats on the latest funding round. Super exciting.
Thanks, Jared. Happy to always. Thank you so much.